Hello, and welcome to a new episode of A Cancer Conversation with the Georgia Cancer Center. My name is Chris Curry, and I am your host for this podcast series. I work as the Communications and Marketing Manager at the Georgia Cancer Center at the Medical College of Georgia at Augusta University. Today, we are going to be talking about a global movement created to bring an end to the burden cancer has on the lives of survivors, their caregivers, their friends, and the communities where they live. So every year on February 4th is World Cancer Day. Today, I am joined by Dr. Jorge Cortez, Director of the Georgia Cancer Center, to talk about World Cancer Day and the role the Georgia Cancer Center plays in closing the care gap when it comes to cancer care and research. Dr. Cortez, thank you for joining me for this conversation.
Thank you for having me.
Well, we are honored to have you. Let's start off by talking about the theme for World Cancer Day 2023. They have a theme every year. This year's theme is closing the care gap. So let us begin our discussion with what this theme means to you and the work that we do here at the Georgia Cancer Center.
I think this is a very important theme because we have recognized, and we probably have recognized it for a long time, but it's come to the forefront more prominently recently. The fact that although we have made tremendous advances in the treatments that we have developed for cancer, the outcomes overall, the improved survival, and many other aspects, there is a duality, and there are some populations that are being able to reach all of these advances and have the benefit of these improved survivals and better quality of life and all of that. But there's a very large population that we know are not having that access to care, whether to early detection, to prevention, to the treatment with the best treatment options, the proper monitoring, even the survival strategy. So there are these disparities that translate very prominently in the outcomes of the patients. So what we want to do is close that gap, make sure that those benefits that reach many really reach everybody, that we have the same care for anyone who lives in a large metropolitan area where there may be a comprehensive cancer center, but also to somebody who lives in rural Georgia that may have only a smaller clinic around and has other elements that make the care very difficult. We need to look at all these determinants, social determinants of care, which goes far beyond just, for example, having insurance. It is a very complex element. There's so many factors that play a role that putting the focus on closing this gap becomes very, very important. For one, we need to understand why these gaps occur. And then, of course, we need to address how we're going to close this gap. So, and by the way, this is, of course, very relevant for us here in Georgia, but also it's a fact globally. Mm-hmm. And sure enough, we want to make sure that this is true for everybody all over the world. Leaving a large group of the population behind in our great research, in our great advances, in our great discoveries, in our improved care, in our improved survival, doesn't really serve a good purpose. Everybody should be able to benefit from whatever we do in terms of something that's going to help them either prevent, diagnose early, or treat cancer, and also the benefit of a survivorship approach once they've completed the treatment for cancer.
And I think that's an important aspect of the work that we do at the Cancer Center, because we are always so focused on treating the entire patient and making sure that the entire patient's needs are met, from their medical needs, their financial needs, their travel needs. I mean, we like to say that we are Georgia's Cancer Center, so we do see patients from all over the state that all have their own challenges.
Absolutely, and it's a very complex interaction of all these factors. Very frequently I hear these simplistic approaches about how you're going to manage a patient that lives in a rural part of the state. You're going to give them a travel voucher. Well, that ignores the patient or the individual as a whole, and even their families. Many of them don't have. They may have children. They don't have a way to leave them back home, even if they have the transportation means. For many, they work. If they miss a day of work, they don't get paid, or even they don't have the luxury of having sick days that they can take for this care. Sometimes it's just an educational component that we have neglected, that we have not provided the tools to have them understand the importance of the treatment, the studies, the visits, and so on. So it is indeed, as you mentioned, a very holistic, a very comprehensive approach that we need to take, and that we do here at the Cancer Center, so with that we can try to help everybody from all the angles that could provide them that opportunity to have an adequate outcome and defeat cancer.
Can you share information about some of the specific programs and projects we have at the Georgia Cancer Center created to bring cancer care closer to where people are living in the state of Georgia?
Certainly. We are doing a number of approaches that I think are very valuable. And as good as they are, we have a lot of work to do, but I think that we at least have had some very good success in some of these with some of these programs. We work very extensively with our population health and outreach group to educate the patients, to tell them about cancer. And this is very important because that includes how they can prevent cancer, and even provide them the tools with simple messages, giving them access to sunscreen and these kind of elements that are going to help them with the early diagnosis. We are also focusing on screening and bringing that screening closer to the patients. So, for example, we have a grant in collaboration with our friends from Georgia Core, where we're trying to improve the rate of colonoscopy for early detection of colon cancer. We have another program on teledermatology, where we provide primary care physicians in rural Georgia with a dermatoscope that can be attached to their iPhone. So whenever they see a patient that has a suspicious lesion in their skin, they can transmit it to our dermatologists. And this is meant in areas where there's no dermatologists many miles around. We're also building mobile units. We have one right now in production for a screening for women's cancer. So it's going to be a unit that's going to have 2 rooms, one with a mammogram, where we are going to be able to do the mammograms for women, take them around the state. And the other room is to screen for cervical cancer. Cervical cancer is a cancer that we can prevent if we do proper things, certainly the HPV vaccine, but also the screening for the cancer. So we're going to be building these, and we're working to try to bring also a mobile screening unit for tobacco-related cancers that could include lung cancer and mouth and throat cancers. We also have other programs that are for treatment of certain cancers. For example, we've developed, Dr. Gilel and Dr. Cora here from our hematology transplant team, they've developed a program where patients with a unique type of leukemia called acute promyelocytic leukemia. This is a leukemia that's very curable, but the management is complex. It's difficult. And what they've developed is a model where the patients stay where they are, and the physicians call And they call them all the time, any time of day or night, and it doesn't matter if it's a weekday or weekend. They get all these calls, but they tell them how to manage, what to do with the treatment for the leukemia, with supportive care, etc. And with that, the mortality that happens during the first few days or weeks of the treatment has dramatically decreased to only 3%. And this has become a model, something that's been highlighted by our colleagues from the NCI and others, because it's so innovative. The patient can stay where they are, but we provide the benefit of the expertise of individuals like Dr. Cota and Dr. Gilela. So a number of initiatives that we're trying to do to help the patients get all the benefits and stay closer to where they are.
Why are programs like these so vital to closing the care gap in this state?
Well, because we need to bring our expertise, our tools, our knowledge, our therapies where the patients are. As we mentioned earlier, patients cannot always come to us, and we also can educate some of our colleagues, primary care physicians, who may be the ones who are seeing a patient that may have a cancer-related problem, so that they understand what things they can do themselves and when they need to refer them. So by working with the primary care physicians, with the patients, with the community leaders, which we do also a lot, that is going to help those patients have those benefits that right now we have not been able to bring to them. And part of that is because we always have been very, very centric to the major cancer centers. Patients have to come to us. We'll do the best for you as long as you can get here.
Yeah.
Well, we need to bring all of that to them.
Yeah. So, Dr. Cortez, you've mentioned a couple of times now a number of barriers that patients face, be it transportation, insurance, lodging, childcare, having time off from work. In your experience and in your expertise, would you say that one of those is more often the reason that a patient can't come here than others?
That's a very good point that you bring, because I think what happens is that all these factors interact, but very differently for each patient. For example, for a patient, it's just the fact that they don't have the transportation, and if you provide that, they'll be able to make it. But for another patient, it may be the fact that even if you give them transportation, there's nobody to take care of their family when they're absent, even for a day, for example, if there are small children or so on. So one of the very interesting projects that we're working on right now is looking at the social determinants of health in how they affect the outcomes of patients with cancer, and working on this project with a couple of colleagues from other campuses here at Augusta University, Dr. Gagan Agarwal from the School of Computing and Mathematics, and Dr. Andrew Ballas from the School of Allied Health. And what we want to see is develop a model where by using artificial intelligence, we can integrate all these variables, and with that, see what interventions would have the most impact for each individual patient. So, we're starting from the very basics, from understanding what social factors affect more these outcomes, how they interact with the cancer per se, what stage the cancer is, and so on. And then, so looking back at what's happened to our patients, and then build that model where we can hopefully start predicting and planning the interventions that would have the most impact. So I think it is a very complex interaction, and it varies widely. Certainly, helping with transportation is good, but sometimes that's not enough for every patient. And we need to understand the other factors and address them as well.
That sounds like a very interesting research project. I'll be very curious to see what you all find when it's finished.
It's a long project, so it's going to take us a little while, but we're making some nice progress. So.
Good. Of course, providing patient and family-centered care for our patients and their caregivers is the most important responsibility we have here at the Georgia Cancer Center. But a lot of the laboratory research underway here is also focused on patients, putting patients at the center of the research. How important is it for our scientists to keep these patients as the focus of their research?
Oh, it's hugely important. I think that we need to understand that a lot of the disparities in outcomes that we see when we look at different populations of different race or different sex, they have to do with the social determinants, but some of that is the biology of the disease may be different. So it could be, and we know that in some cancers, it is true that breast cancer in African American women is more aggressive than breast cancer in white women. And so it's not just a matter of that they may not have as much insurance or things like that, but it's the biology itself is different. So we do have a number of our investigators who are precisely focusing on these issues. What is the science? What is the biology behind those differences that is also contributing to those discrepancies in the outcomes? We have individuals like Dr. Hassan Korkaya, who has a very nice project looking at these differences in biology in African American versus white women. And in many other areas, we're exploring the same thing. So I think it is also a matter of research in the laboratory. So it's a whole spectrum from social factors to biologic factors that we need to take care of.
Now, you have been the director of the Georgia Cancer Center since September 2019, and I know you've talked about spending the second half of your career here. Why do you feel like a long-term investment like that is so important?
Well, because I think that right now I've seen two different spectrums of cancer care. For the first part of my career, I worked at MD Anderson, an institution that is always at the forefront of the research in the laboratory, in clinical research, and so on. And it's very valuable. The work that I did there, that my colleagues continue doing there, it's hugely important. But the work that we do here now, where we tend to a population that has such great needs, where our coverage area really are those patients that have very little access to care, that we have not really paid as much attention to, is become a lot more evident to me. And I think that right now, this is probably our most urgent need in the country in terms of cancer care. How can we get that population that's been left behind to catch up with the advances that we made in other areas? We did a study where we looked at the outcome of patients, for example, here in Georgia, of patients with different types of cancer, and looked at the elements that participate in their probability of surviving after the cancer. And what we found is that there are a number of these factors. Age certainly is important. The income is very important. And another one very important is the distance to a cancer center. So, and the most troubling part of it, at least in my view, is the fact that in those cancers where we have better therapies, those differences become more meaningful. They're amplified. So if we have good treatment, but the patients cannot have access to that, well, then it's not a good treatment. So that realization has become a passion to me to say we need to do something. That cannot be that we're leaving such a large percentage of our population right now in the state. I become a Georgian now. This is it bothers me that it happens in the state. Of course, it happens in any state, but for the moment, we do need to work on that for our citizens here in Georgia.
And what message do you have for those who may be watching or listening to this podcast about bringing cancer care and clinical trials to the communities where they live? How would you sort of sum up a lot of what we talked about today?
I think that they need to realize that we have resources available for them. It's always very good to try to get informed as much as they can. Certainly directly through their doctors. We can work directly with their doctors so that we can do something like we're doing with this program for acute promyelocytic leukemia. It may work different in other settings. We don't have it formalized in others, but at least have that communication with the doctors, educate themselves about what they can do about everything from preventing cancer to diagnosing it early. All those things can be done mostly in their communities. And then bring us feedback. What can we do? How can we help you? I think that there are many approaches that perhaps our patients and our colleagues that work in those remote areas, in rural areas, understand much better than we do. We want to hear that so that we can better address them and together work on improving the outcome of the patients.
So this podcast will publish on Friday, February 3rd, which is the day before World Cancer Day. So just about a month into the new year, what excites you the most about 2023 when it comes to cancer research and patient care this year?
I think that there's a lot of great advances that are happening, and I think that this year is going to give us a new wave of new discoveries in the laboratory, new therapies in the clinic, new modalities of early detection and so on. I think the emphasis that has been put on this early detection in the prevention through the moonshots that have been proposed by President Biden, these are very, very important. I think those focuses on the early stages and having more attention and hopefully more resources to bring these to the population that needs it the most. I think we're going to see a lot more this year. So I am very hopeful that with the increased attention to this closing the care gap, this year is going to really be our sparkle that we need to really make a difference in that. I truly believe that will be the case.
Well, Dr. Cortez, thank you for your time today, for sitting down with me for this conversation.
My pleasure. Thank you for having me.
Now, when we return, you will hear how we are working to reach people and educate them about World Cancer Day and how they can lower their risk of developing cancer. We will be back in just a couple minutes with Mary Claire Regan, a member of the Cancer Center's Cancer Prevention, Control, and Population Health Program.
Let us help you and the people you care about quit tobacco for life. We offer an integrative approach to help tobacco users quit successfully. Now, this includes cigarette, cigar, and hookah smokers, electronic cigarette users, as well as chewing tobacco users. Our cessation clinic and classes use proven research and evidence-based methods to help you and the people you care about live a healthier life without tobacco. You can make an appointment today by calling 706-721-0456. You can also email stoptobacco@augusta.edu. The research and innovations developed at the Georgia Cancer Center ultimately influence the global network of cancer care. Our team fights for far more than just Georgians. The learnings achieved through the care of local patients has wide-reaching implications for creating tomorrow's standard of cancer care. Through facilitating first-in-the-nation clinical trials and growing a depth of understanding only available through a multidisciplinary approach, the Georgia Cancer Center team is equipped to deliver treatment advances that will be applied in facilities across the world. If you are recently diagnosed with cancer, call 706-721-6744 to schedule an appointment with our team today.
And we are back. Thank you for joining us for this episode of A Cancer Conversation. Today we are talking about World Cancer Day, a global movement created to bring awareness about ways to improve our health while taking steps to reduce and even eliminate certain risks of developing cancer. Joining me now is Mary Claire Regan. Mary Claire is a community program coordinator with the Cancer Information and Awareness Program, part of the Cancer Center's Cancer Prevention, Control, and Population Health Department.
That's right.
Mary Claire, it is good to see you today and to talk with you today.
Yeah, Chris, thank you for having me.
Absolutely. So, Mary Claire, you are really one of those on the front lines when it comes to educating people about their risk of developing cancer, right?
Yeah, definitely. So the Georgia Cancer Center plays an integral role in cancer awareness in the CSRA and beyond. So as part of the Cancer Information and Awareness team, which is a mouthful,
Yes.
It's my job to educate folks about different kinds of cancer and how they can reduce their risk. So our team is here to provide information to the community, and we do that in a number of ways. So we can offer presentations, we table at health fairs, and we also offer printed materials to folks. So shameless plug for our team. You can reach out to us. Chris can link our website under this interview, and that has our phone numbers, our emails, and lots of other information about our team.
Yeah, absolutely. We will put that in the show notes for sure. So Saturday, February 4th, 2023, World Cancer Day, but you and your team are getting a jump on the day by sharing information about cancer risk and prevention today, right? Today we'll publish this. It's Friday, February 3rd.
Right. So for us, it's like every day is kind of like World Cancer Day at
Okay.
the Cancer Center. I'm sure you kind of feel the same way.
Yes, some days.
It's like 365. This is what we do. But it is important to have like awareness days to bring like heightened attention to issues like cancer. And we really want folks to know, though, that every single day they can make decisions to help them reduce the risk for cancer or to get it treated early, which really increases survival rates. The World Health Organization actually estimates that a third of cancers can be completely prevented.
Oh, wow.
And another third can be completely cured if they're caught early.
Okay.
So we really want to let people know that and empower folks with information so they can make the best decisions for their health.
Early detection can be very important. What are some ways those watching and listening to this conversation can reduce their risk of developing cancer?
So like I just mentioned, about a third of cancers can be completely prevented because of behavioral risk factors. So that's basically everybody's day-to-day choices. So Chris actually printed this for us, this little nifty guide, and it has some ways that you can reduce your cancer risk. So choosing healthy foods is one way, so increasing your vegetables, whole grains, fruit intake, moving more any way that you would like. So that could be gardening, walking with your dog, walking with your family, or having a gym routine. But there's one really, really important one, and that's quitting vaping and tobacco. So you can come and see me for more of these on World Cancer Day. I will be at the main hospital in Entrance A, and you can check out our website. Quitting tobacco is the most important decision you can make for your health. It's challenging, but the rewards are numerous, so it's definitely worth doing.
Yeah, I know that can be a tough task for some who may be watching or listening to this podcast. But our tobacco cessation program is laser focused on giving people the tools to help them quit for life. Can you share information with me about that program?
Yeah, definitely. It's an incredible program. I do want to note that quitting tobacco for many is a challenge, like you said, and it's not anything to be ashamed of. There's a lot of a stigma attached to tobacco use, and there really shouldn't be, because it's really the tobacco companies that are so predatory, and they target marginalized communities, and they target young people. So the CDC estimates that 90% of folks who use cigarettes today started smoking cigarettes before the age of 18.
Oh, wow.
And then 99% start before the age of 26.
Okay.
So as we know, our brains are developing during
Yes.
that time.
Yes.
The tobacco companies know this. And so it wires our brains for addiction. It makes it really, really hard to quit because you made that connection so young.
Mm-hmm.
So the tobacco cessation program at AU is incredible. Fonda Dobie runs that program, and she and her team are trained at MD Anderson, which is the gold standard for tobacco cessation coaching. And they use a two-pronged approach. So they use counseling, and they also use pharmacotherapies,
Okay.
which is also
Pharmacotherapies.
Pharmacotherapies,
All
which is
right.
also a mouthful, but basically that's just medication that helps people quit. So it could be gum, lozenges, medication like Chantix, the patch, things like that.
Okay.
So they use evidence-based practices. They have one of the highest success rates in the country
Oh, wow.
for their program. So
That's
it's
awesome.
definitely worth checking out.
Yeah.
So I have their phone number here, so
Okay.
I'm going to
You
get
can
that
get that.
out.
Go ahead.
So that is 706-721-0456. And you can also email stoptobacco@augustahealth.org. And Chris, you can probably link their website under this as well. So
I sure
I'm going to
can.
have probably like 4 websites.
That's
for
okay.
you.
Hey, we want to give the people information that can help them live better, live healthier lives, reduce their risk of cancer. So
Love it.
All
Yeah,
right.
you're basically a member of the Cancer Information and Awareness team.
I'm honored to be a member. So what role do you believe the Cancer Center serves in closing the care gap? So closing the care gap is the theme for this year's World Cancer Day. What do you believe the Georgia Cancer Center's role in that is?
Yeah, so this has actually been the theme for the past 2 World Cancer Days because it's so important. And our Cancer Center has a huge role to play as one of the leading cancer treatment centers in the state of Georgia. From our research teams to our healthcare professionals to our cancer information awareness team,
Yeah.
we all have a role to play. And it's all about basically reducing disparities. So a lot of folks have been left out of cancer care and healthcare in general because of certain identities that they hold. So folks from rural communities, people who are disabled, the LGBTQ plus community, elderly people, people of color, all those people have been marginalized, and that has reduce their access to cancer information and like very good quality cancer care. So it's all of our jobs, in my opinion, like provide the information that's really important, but being aware of these identities, being welcoming to these identities, and then noticing these identities in folks, asking them their identities and helping them work through the inequities that they face. I think that's what we can do as a cancer center to really help close the cancer care gap.
So taking steps to improve our health can help us lower our risk of developing cancer, talking about the fresh fruits and vegetables, stopping smoking, get moving. But there are also screening opportunities available for certain cancers that we want to talk about too.
Definitely. Lots of screenings are available for cancers. And getting screened is so important because, like I said earlier, about a third of cancers could be like completely resolved if they're detected early, and part of that is getting screened. So the earlier a cancer is detected, the more treatable that it is. And screening can be scary, and we understand that at the Cancer Center, but getting screened for a scary disease is better than losing you to a disease that could have been prevented. So there are actually a ton of screenings, and I could go through all of them right now, but it would take like so much time. So I'm actually going to send Chris the link to the American Cancer Society's website where they have screenings in alphabetical order by age, so that you can make sure you're getting the screenings you need. It's also really important for folks to talk to their primary care physician so that they're getting screened on time and they're getting the screenings that they need. So I also want to note that the American Cancer Society has a resource on their webpage where they have the screenings listed for folks who are uninsured and underinsured, so that they can go to health centers that will offer that care either free or at very low cost. And the Georgia Cancer Center actually has a bunch of screening programs and care available for folks in that category. Shout out to Erin Crisco at the Breast Health Center. So we're doing a lot there too. And I just really want to encourage folks to call their care center, if it's the Georgia Cancer Center or wherever you're receiving your care, and ask for those resources, because cost should not be a burden. It should not prevent you from getting screened, and it should not prevent anybody from getting cancer treatment.
Absolutely. Thank you for that. So it sounds like educating people, giving them the tools to live a healthier, happier life are the keys to bringing down their risk of developing cancer. Wouldn't you agree?
Yes, definitely. Information is power. That's why I love my job. I think giving folks the information they need to make informed decisions for their care makes a really big difference. And at the Cancer Center, Georgia Cancer Center, we're working really hard to provide people with that information, and also to provide them with the quality care so that they can make the best decisions for their health and have the best health outcomes possible.
Now, I see you have some other props here. For those that
I
are
do.
audio listeners, you can't see them, but
Yes.
those of you watching, you can see them. What are they? Talk to me about a little bit about those.
Yeah, so Chris actually printed these off for us, so thank you for
You're
doing
welcome.
that. So these are just World Cancer Day posters. So you can see the theme at the bottom, Close the Care Gap. And this one, for those who are listening, says, "We identify differently, but we agree wholeheartedly." So this is representative of folks in the LGBTQ plus community, and they are at a disproportionate risk of 7 different cancers, and so we really want to make sure they have the information that they need to make informed decisions about their health, especially around cancer. This population also uses tobacco at a incredibly high rate, and part of that is because they have been targeted historically by the tobacco companies. So we want to make people aware of that. And then we also have this gorgeous one, and it says, "Race doesn't define you, so why should it deny you?" So we know people of color have historically been denied quality health care. So part of closing the care gap is making sure that folks, no matter how they identify, whatever their racial ethnic background, gets the quality care that they deserve.
Dr. Cortez was actually saying that there are some cancers that are more aggressive in minority, African American and other minority populations as
Definitely.
opposed to Caucasians. So.
Yeah, like breast cancer in Black women, it can be more aggressive. It also can invade their bodies at a younger age, and because of that, they have a higher risk of dying from breast cancer. And so we need to be doing everything we can to make people aware of that, not to scare them, but to give them the information they need to get screened, to talk to their doctor about the risk of cancer.
Yeah.
Because if you have an identity like being a Black woman, or like being an LGBTQ plus person, or all these different, being elderly, there's a bunch of different identities that increase your risk of different cancers. And so it's really important to know that so that you can make the best decision for your health.
Absolutely. And that last one.
And that last one. So speaking of our elderly community, your health matters no matter your age. So folks who are older might have trouble accessing healthcare because maybe they're not comfortable using the internet, or so they don't have the information that they need, or they are not able to drive anymore, so they don't have a way to get to the clinics. And the truth about cancer is that it affects older people more than it affects younger people. That's probably the biggest population that's actually affected, because as we age, our DNA suffers damage, and that damage compounds. It makes it more likely we'll get cancer.
Okay.
So a lot of folks are over the age of 60 when they're
Okay.
diagnosed.
Okay.
So it's important to know that. It's important to call your care centers to see how they can help you get a ride, how they can help you get information, how they can help you get healthful food so that you can eat better, give you ideas for exercise. People who are elderly might not be as able-bodied as others, but there's lots of ways people can exercise, and getting exercise any way you can is important.
Yeah. Any amount of exercise. is
Any
good
amount
as-
of, right, we encourage, it's like there's a certain amount that is recommended, but any movement is better than no movement.
right.
And it doesn't matter how you get it. I climb the stairs at work, and there's a joke at the Georgia Cancer Center that the parking is so terrible, so employees have to walk. So
Yes.
it's part of the health promotion strategy.
yes,
So,
walking.
but it all adds up, and it all helps.
Well, Mary Claire, thank you for joining me for today's discussion. I appreciate you and Dr. Cortez for taking the time to sit down and share important information about cancer risk screening and how the Georgia Cancer Center is working every day to close the care gap.
Happy to do it, Chris, and thanks for giving me a platform to talk to folks about this, and we really appreciate the work you do. It's really important.
Well, you and your team are always welcome on here. Just let me know when you have a topic to talk about, and we'll schedule a day and time.
Awesome. I appreciate that. Thanks.
Well, thank y'all for watching or listening to this podcast, A Cancer Conversation with the Georgia Cancer Center. You can find us on YouTube if you want to watch. You can also listen to us on Apple's podcast, Spotify, and Google's podcast. Please make sure to subscribe, leave us a review, let us know what you like, what you don't like, because we are here for you. So we will see you next time.